I'm not gonna. Good afternoon, Derek.
Good afternoon.
It's good to see you today.
Good to see you too.
So I know that you filled out some paperwork before you came in with the secretary.
Yeah, I felt like I was signing my life away.
Yeah, I know, it's a lot.
Yeah.
It's a lot, especially the first time. After that, it gets pretty easy. There's not really much else to it. I just wanted to clarify with you, I'm sure you read in the paperwork that there's some confidentiality clauses. Basically, just anything we talk about will be confidential. The only thing that wouldn't be is if you were to say something about harming yourself or harming someone else. So outside of that, you can feel free to be comfortable and talk about whatever you need to, and it'll stay in this room. Great, great. Well, let's get started. What's bringing you in today?
Well, for the past 7 months, I've been, I refrained from using drugs and alcohol, and I've been going to meetings, been doing all that stuff, and trying to maintain my sobriety. But lately, it's just my anger, my impatientness. Everything that I used to act like when I was on drugs, I'm starting to act like off of drugs. So I don't know, maybe if there's like a deeper issue that I have to take care of, or maybe a different plan that I gotta follow. When I was doing going through the program, they had a plan of action just for drugs and alcohol.
Yeah.
I mean, I follow that every single day, but it's just, I don't know. I kind of feel like there's like deeper issues going on, that I would like to take care of. My girlfriend pointed that out. She's like, "You've changed." I mean, she calls me on my stuff all the time lately.
Mm-hmm.
Before, it was just so much easier. I don't know. I mean, it's just maybe there's something that I see, that I don't see that other people do.
Mm-hmm.
And she says like, "Hey, why don't you go see a counselor?" I'm like, "Yeah, fine." I could tell that she's like at the end of her rope.
Yeah.
So it's like I want to try to make things easier for her and me.
Mm-hmm.
And I know, it's a lot of it's my problem, my fault. And she's trying hard to take care of everything, but it just seems like I'm stressing out over just the littlest things.
Mm-hmm. I can understand. Okay, so I hear you saying that you've been clean. How long have you been clean now?
7 months.
7 months. Okay, that's great. Congratulations.
Thank you.
That's great. So you've been clean for a little while now, and I know you've been working hard on that. And you're still just some of the maybe the old feelings you used to have, like anger and frustration, are starting to come out, and you maybe don't know how to deal with it. Being sober,
I don't.
Yeah. So, and obviously this affects your relationship with your girlfriend, and just it's a struggle for you on your own. So that I can understand that being an issue. I think that's common for anyone coming out of addiction. You're feeling things, for the first time sober that you haven't in a long time. And I think that can be difficult. It would be for anyone. So kind of just want to work on how to cope maybe with.
Yeah, how to maintain things when I'm sober. It's new. I agree. I know it's I have to learn to crawl before I can walk, and all the other stuff that they say in AA and their name. But maybe there's something else. Maybe there's something else I can figure out. Maybe like there's new emotions that I just don't know how to put words to. So
Okay.
kind of hoping to get some answers.
Okay. Are you having any other struggles outside of the anger and your frustration? Your emotions. Are there any other issues that have come up?
Well, lately it's been kind of harder for me to sleep. Maintain a full night's sleep. I'll go to bed, wake up like 5 hours later, getting all restless, and then go to bed and wake up another 5 hours after that, and I'm still tired.
Okay.
And of course my girlfriend's like saying like, "You sleep all day" and all that stuff, and I just, well, yeah, I do, but it's, I don't know.
Has this been affecting work and just your day-to-day life and responsibilities?
Well, when I'm working, it's like, I drive all day, I drive
Mhm.
almost, and it's mentally exhausting either way.
Mm-hmm.
But when I'm working, it just kind of like, you know, it's almost my brain shuts off. I'm driving and, I'm just kind of spacing out pretty much the whole time. I mean, I get there safely, I'm good with speed and all that stuff, but as soon as I go to the, as soon as I go in, like to the airport or something, I just lay back and I just fall asleep.
Yeah.
So it's like, it seems like my whole day is just sleeping,
Mhm.
trying to get rest.
Yeah. Catch up. I can understand that. Did you have any of these sleep issues before? Did you while you were using?
Not really, because when I was using it, it was just, I would black out.
Yeah.
So, if I wanted to go to sleep, man, just, call one of my buddies, pop a Xanax or something and fall asleep.
Yeah. That makes
I
sense.
mean, things were just a lot easier because I could take chemicals to do whatever I need to do.
Mm-hmm. Okay, that makes sense. So, I mean, obviously, you said that this is affecting your energy level, so you're tired throughout the day. It's probably a struggle for you to get through the day if you're not getting enough sleep, which makes sense for anyone.
Right.
How about your appetite? How's that been?
Off and on. I mean, there's sometimes when I'm working so much that I just forget to eat.
Mm-hmm.
Then when I get home, sometimes it'll be around midnight, so I'll make myself like a quick sandwich or something, nothing with too much effort.
Mm-hmm.
And yeah, I know my appetite, I know I should force myself to eat sometimes, but it's just not there sometimes.
Okay. Okay. I know you've talked about the anger and just generally being frustrated and your emotions in general. Have you felt depressed, since you've been sober, or?
I felt some depression, yes.
Okay.
Yeah.
Okay. Does it seem to be severe, or just kind of?
Well, I talked to my sponsor about that. He's like, you know what, depression is kind of a normal thing to get off of drugs.
Absolutely.
And it's like, in the beginning it was up and down. I was feeling the highs and feeling the lows. But, after a few months after that, it just stopped. Just content.
Okay.
I don't feel the ups, I don't feel the downs. It just, just getting by.
Yeah. Yeah. Okay. I've heard that a lot. That's normal. Especially, I mean, you're only 7 months in with sobriety, which is fantastic. That's a huge achievement, but it takes time, for our brains and our bodies to heal and reset from, the years of abuse. And so our cycles, our sleep cycles, our appetite, our mood and things like that can take a while to balance out. So that's totally normal. Have you had any suicidal thoughts or homicidal thoughts at any point?
No.
Okay, great. So your anger, you've been struggling with the anger, and I know work has been difficult because of your sleep. Are there any other issues that you're struggling with?
Not really. Well, I mean, I just don't know. I mean, that's the thing. It's like, I've been using since I was 10, and now I'm 35. With my sponsor, all they really deal with is just trying to cope with life off of drugs, but they don't tell you, they don't teach you how to maintain your life and relationships. I mean, I haven't been in a relationship in like 5 years. I mean, not really knowing how that works and all that stuff. And I know you're not my relationship guide, but maybe just somebody to talk to who could empathize with me, it would be better. I mean, my girlfriend doesn't know anything about drug addiction because she hasn't dealt with that.
Okay.
So, I mean, honestly, my appetite's been crazy. My sleep's been scheduled, my emotions going up and down. And lately, it's just been feeling like I've been frustrated at everything. As soon as I walk in the door, I get this frustration, this impatientness, this impulsiveness. Like I got to do something.
Okay, great. So, how is your home situation? Are you living with your girlfriend?
I am.
Okay. You guys have any kids?
Well, she does. She's got 2 kids.
Okay.
One's 4 and one's 8.
Oh, okay.
No, one's 9. Sorry, I should have said her birthday.
Oh, great. How is that environment, that situation?
Very, I mean, of course, I understand that, as a 4-year-old, he's gonna act out, and, I'm very patient with the child, never get angry with her, with him, or anything like that. There's sometimes when I actually bribe him and, pay attention, like, if you go to sleep now, I'll get you a slushie in the morning.
Mhm.
You got a slushie? And you go right to bed, and of course I go for a look at you, really. But yeah, and a 9-year-old, I mean, me and her, we seem to get along. Me and my girlfriend, we have a very honest relationship. I tell her what's on my mind, she tells me what's on her mind. But it's kind of seems like either I'm pushing away or she's pushing away, and and that's how I was in my past relationships. I don't know whether I'm the one who has a relationship issues, or she does, or
Okay.
we both have a past. So it's not easy having, colliding with it.
So, has she had issues with addiction in the past?
No, I mean, her father was an addict, and her old boyfriend was an
Okay.
alcoholic.
Okay. Okay.
I mean, she was, she had to get away with it, away from him because of his alcoholism. I mean, he wasn't abusive, but he was just, she was scared, basically.
Okay. Okay. So, I'm sure, in your youth you had plenty of friends or people that you used with, possibly. How is your social situation now and your peer support? Like you have.
I just hang out with my girlfriend.
Okay.
I had to cut ties with everybody. I mean, the first thing they tell you, people, places, days,
Mm-hmm.
that's exactly what I wanted to do, because I just don't want to go back to the same life I was.
Okay. Yeah.
I
That's good.
kind of felt like I was a piece of veal, just waiting in my house. And, most exciting part of my day was waiting for my dealer to call me back and say, yeah, we're good.
Yeah.
And now it's just,
Okay. So you've been clean for 7 months, so you haven't had any recent issues with actual drug use. So that's great. That's great.
I'm afraid to take aspirin nowadays.
Yeah. Yeah. I can understand. What were your drugs of choice?
Well, it was basically whatever you got.
Mm-hmm.
And I started with alcohol at the age of, first time I got really completely drunk was 11. I started started experimenting with cocaine when I was 13, 14.
Mm-hmm.
Then it escalated to heroin, and then I quit for a while, went to the military. When I got back out, I was back to using cocaine and heroin again.
Okay. Okay.
Until I was just like, I was done. And
Okay. Well. So we'll talk a little bit about maybe your mental health history, if you have any at all. Do you have any history of any sort of mental health treatment or hospitalization?
no, not that I think of. Actually, no. When I was in high school, I got kicked out of high school, and went to a BD school, and they had me on antidepressants. But the doctor was like just kind of, not giving me assessments. There's like, oh, you're depressed, so you must take this. So I don't even know if I'm depressed or not.
Yeah.
I didn't back then. I was just taking medication because the doctor was telling me to take medication.
Okay.
It wasn't helping, so I stopped taking it.
Okay. Okay. Are you on any medications right now?
No.
Okay. Are you currently seeing a psychiatrist or a medical doctor for any of these issues?
No.
Okay. Okay. Do you feel like maybe you should, maybe talk with a psychiatrist if you think that depression, is an issue or something you should explore?
Yeah, I could explore that if it escalates worse than what it is now.
Okay.
I don't like taking medication anymore.
Mm-hmm.
I don't want to be on anything that I'm. It took me 7 months to get off the drugs. Why do I want to take more drugs to, make myself better? So I don't even know if I'll take take them.
Okay.
Get the prescription.
Okay. So, I know your girlfriend's family has had some history with alcohol abuse with her father and her ex-boyfriend. Do you have a family history of?
And my dad was an alcoholic. My mom, she's more of like I wouldn't say control drinker, but like a current drinker. What they say. I mean, she only has like one glass a night before she goes to bed.
Okay.
I mean, she doesn't get out of control. My brother, he was doing drugs with me, so he's an addict too.
Okay.
But he moved out to Idaho right now. So
Okay.
yeah.
And do you see him very often?
Yeah.
Okay.
I don't even talk to him anymore.
Okay.
It's been about a year since I talked to him.
Okay. Does he know that you're clean and sober now?
Yeah, but it's me and him. We have like a very crazy past. You know, I mean, he burned a lot of bridges with my parents, and my parents was just like, you know, leave, just get out.
Yeah.
So he moved out to Idaho with a friend of his, and
Okay.
he just never came back.
Okay. How is your relationship with your parents right now?
That's good. That's good. I mean, I'm honest. You know, I don't take anything from them anymore. I am just doing as much as I can with what I got, and I mean, we're fine. I mean, we're talking. You know, I made my amends with them, and you know, there's just a little piece of me that thinks that they still don't trust me. Like if something was to go missing, you know, I'll be like the first one they point fingers to.
Okay.
So,
Okay. So trust is you're struggling with trust. People trusting you again since you've been clean,
Yeah.
even though you're doing the right thing.
Well, I mean, to be honest, I'm at the point in my life where I just don't care what people think. You know, you can trust me or not. You know, whether you do or not, that's on you, not on me. I mean, I'm just trying to do the right thing every day.
Okay.
But I mean, sometimes it's harder than as it sounds.
Mm-hmm.
You know, I mean, I got 30 years of crazy behavior that I had to change, and you know, sometimes it can just be a little anxious.
Okay. Okay. All right. Well, I know that you've been clean sober for a while, so a lot of issues with work related or social related may have gotten better or improved. Are you having any conflicts or issues with coworkers or anyone else in your family due to maybe the anger or frustration that you've been dealing with?
No, because it's just me. The only kind of relationship I have at work is between me and my boss.
Okay.
Like when I'm driving, I'll call him. Yeah, I'm picking up this guy.
Mm-hmm.
I'm cleared, and that's the only interaction we have between them.
Okay.
I mean, if there's another coworker at the airport at the same time, yeah, we may BS a little bit, but
Okay.
there's no way to get into any kind of conflict situation.
Okay.
Situational conflict.
Okay. So you've only had the one mental health issue when you were in high school. You said where they gave you antidepressant for a while. Is there a family history of that though with mental illness?
Well, I believe my cousin has, but she's got depression. There's a couple family members who have depression on my mom's side. I think my mom might even be depressed, but it's never been assessed. There was never assessment on it. She never talked to anybody.
Okay. Okay. Well, that's good. We've gotten some good information. So you'd like to work on, just basic. What I'm hearing is maybe the just general emotions and feelings. Now that you're clean and sober, dealing with, just life in general, your relationships, specifically some anger that you're dealing with regularly, or getting frustrated quickly with, the day, or whatever may be going on during your day. Maybe some low mood issues you said, where you just kind of feel, the same all the time, necessarily up or down, just sort of a little bit low or, you know. So those are some things that we can work on, and maybe try to figure out a little more about where that's coming from. Are you and your girlfriend, is there any physical violence at all? Are you guys fighting physically or anything like that?
No, I've never been a violent person.
Okay.
You know, I catch myself. You know, I kind of, there's some situations where she frustrates me, but you know, I just walk away, or I just smile and just wave at her, and she'll get even more ticked off because she knows she can't change my attitude.
Okay. That's great. Okay, so is there anything else that you'd like to work on as we go through this? Are there any other issues that maybe you're not thinking about or you forgot to mention or that you'd like to work on?
Maybe quit smoking.
Okay.
Get back in shape or something.
Yeah. Yeah. That's common, I think, for people who get sober,
Yeah, I gained like 30 pounds in 2 weeks.
Okay. Yeah.
Yeah. When can I lose that?
I've heard that a lot. You're clean and sober now, and what are you going to do with yourself? Sometimes eating or smoking, even maybe you smoking even more. Sometimes people do, so that could be an issue. Okay. Well, I think we got a lot of good information here. I'm just trying to make sure that we've covered everything that we wanted to talk about today. Okay. So I think we have a good foundation here for what we might want to start working on in our following sessions. Did you have any questions about anything we talked about today so far? Nothing. Okay. Okay. Well, maybe next time when you come in, we can start to try to work on maybe a plan, or maybe uncovering some of the underlying issues that might be causing the anger or frustration. That could have been a big part of why you started using it in the first place, and could be even carrying over until now. So, we can work on that.
All right.
If that sounds
good. Yeah,
okay.
that sounds real good.
Okay, great.